called? Paraplegia. Very good. So if it is one side, it is the hemiplegia. Okay. So whenever you are assessing a patient with weakness, okay, so see whether the patient is presenting with hemiplegia or paraplegia, okay, because the causes may be different. Because the paraplegia, the problem may be at the level of the spine, okay, so it can be in the brain. For example, multiple sclerosis can have problem at multiple levels, but still, if there is hemiplegia, where is the problem? Problem is here. So problem is above. Okay, so this means if there is a problem only in unilateral, one side of the body, so this means that the area affected is the brain. Okay, so motor neurons in the brain are the most likely affected. And if there is a paraplegia, there is a possibility the problem is in the brain or is in the spinal cord. Okay, right. So again, I repeat that the component of the motor system. So we start with bulk and nutrition. Bulk and I will tell you how. Then tone. Okay. Power. Okay. The bulk and nutrition, tone, power, reflexes. Okay. Gait and signs of meningeal irritation. So these are the 6 components of the motor system. Okay, so you start with the, so as I mentioned, you will follow the same. Read yourself, I am Dr. This, I want to examine, and I will try to make sure that my examination doesn't harm you. Okay, take permission, expose the area which you want to. So just have a look at the inspection for the bulk and nutrition. What does that mean? For example, a patient who has just like muscular dystrophy, as you mentioned, there was a lecture on muscle. So muscular dystrophy means that the muscles will be damaged. Okay, atrophy. So there is a possibility that there may be loss of muscle and the muscle bulk will be reduced. Wasting. Yeah, wasting. Very good. So wasting. Okay. So you can look at sometime in some of the muscular dystrophy there could be pseudo hypertrophy. Okay, and these areas, these are the one. So pseudo hypertrophy is not in these areas. So this is wasted, and in the calf area there could be pseudo hypertrophy. Okay, so just look at the bulk and nutrition and see comparison one by one. Is it equal on both sides? Because this is what you are saying. Okay, so just have a general idea about the bulk and nutrition. Okay, then how you confirm that is it equal? Just a rough estimate, palpate like this. And the most scientific method of checking it, take a measuring tape. Anyone having the measuring tape or no? No. Okay, so take a measuring tape, mark a bony prominence. For example, this is the medial malleolus. Say you go up from medial malleolus to 10 to 15 centimeter above and see how much is the diameter. Okay, say it is 15 centimeter. Okay, check it on the same point on the other leg. Okay, a difference of up to 2 centimeter is normal. For example, here it is 15 centimeter, it is 17, so normal. Or here it is 15, it is 13, it is normal. Anything more than 2 centimeter difference between both sides, it is abnormal. Okay, the side which is abnormal could be the one having reduced or increased. For example, if patient having a DVT, so you expect the affected side to be swollen. Okay, so the problem can be either on the side which is shrunken or the side which is swollen. Okay, then the same, this is the knee joint, this is the patella. Take a mark from patella 10 to 15 centimeter above, measuring tape and measure it. Okay, so this is how you will check for the bulk and nutrition. Okay, this will tell you if there is a, for example, if there is a motor neuron disease like in which there may be upper motor neuron or lower motor neuron. So lower motor neuron disease, for example, it was wasting. Okay, typical symptom, typical sign is the wasting or emaciation. Okay, so you will find that on the examination of the bulk and nutrition. Okay, then the next step which comes is the tone. Okay, after bulk and nutrition comes the tone. Okay, so how you check? First of all, whenever you are checking the tone is something which you will check yourself and ask the patient to just relax. Okay, just don't resist. Okay, completely relax, because if it is not relaxed, you may get a false impression that there is an increase on the tone. Okay, so just ask the patient to loosen the body, just relax. Okay, then how you will check? You will check by the passive movement like this. Okay, and see if there is normal tone or reduced tone or increased tone. Compare one by one, very important. When you are checking on one side, you must compare it on the other side. Okay, so after this, then you check like this. So this is by the passive movement. So you check the tone by the passive passive movement. Okay, so if you found the tone is increased, as someone was asking about the clonus. Okay, so if the tone, you feel the tone is increased, then at the same time you will check for the clonus. So ankle clonus, how you check that? You place your hand like this with a downward pressure and do it like this. Do it 3 or 4 times and then sustain it. Okay, so what you will find? Jerky movement. Okay, flexion on the flexion. So this is ankle clonus. Okay, so this is a sign that this patient have a clonus or hyperreflexia. Most of the time it is seen in upper motor neuron type lesion.
Doctor, how to examine the hip joint, tone of the hip joint?
Huh?
Tone of the hip joint.
I said that you can check the tone of the hip joint like this. Okay. So, for example, it is by the movement like the external rotation and internal. Okay, so because you just flex it and rotate it externally and internally. Okay, but for exam point of view, you don't need to check one by one every joint. Okay, because if the tone is increased, it is likely to increase. So that is what I am saying. Just check the feet and do it like this. Okay, so if you do it like, and once you are doing it like this, also you can move it side by side. So that is how you will be able to check it by the in all the areas. Okay, so bulk and nutrition followed by tone. Then comes the power. Okay, so that is again one of the most important. Now tone you check with the passive movement and power you check with the active movement. Okay, so how you check? First of all, see, without anything done by you, ask the patient to raise the leg. So what are the grades of power?
3, 4, 5.
Huh?
It's 3.
3 grades?
No, it's 5. No, just 6, but it starts from 0.
So 0 to 5.
Yes.
Okay. So it is here, it is not like GCS, here it is from 0 to 5. The power is 0 to 5. Okay, 0 means no power and 5 is the. So ask the patient to raise the legs, or if you are examining the upper limb, ask the patient to raise the arms. Okay. If the patient is able to raise, what is the power?
At least
3. Very good. Now comes your duty. What you will do? You will place your hand on that, applying resistance. Ask the patient. Now again, you can do it. First of all, ask the patient to raise. So you will not raise, the patient will raise. Okay, and you see on both sides, is it comparable, or one side is moving less against resistance as compared to the other side. Okay, so this is, now you can check power in the groups of muscle one by one. Okay, so this is general. So how you again in the lower limb, here you place your hands downward like this. Ask the patient to press on my hand or push on my hand. Okay, like this. Okay, similarly compare one by one. It is not that you do one side on one and then you come on the other side. Compare one by one so that you can have an idea at the same time. Again similar, ask the patient to press downward. Okay, once done with that, then ask the patient to push and pull my hand upwards. Okay, so just like this. Okay, so you place your hand like this and ask the patient to do it like this. Okay, compare it on the other side. For specifically for toes, you place your fingers like this and ask the patient to just move the toes. First downward, then upward. Okay, so this will tell you about the power of the toes. Okay, now after doing this is the movement of the toes and the ankle. Then come the knee. So in the knee joint, primarily you check two movements, which is the flexion and the extension. So how you check? Ideally, you place the knees like this. Ask the patient to straight the knee. Okay, so if he straight the knee against resistance, this is extension. This is knee extension. So when you straighten the knee, it is knee extension. Okay, check extension and then ask the patient to put it in the same way. So what will happen? You will place your hands like this and ask the patient to flex. Okay, so this is knee flexion. So these are the two major movements you check on the knee joint. Okay.
Foot in the ground, doctor. Foot in the ground or above the level of the ground.
No, you see if the patient is, you can, for example, if you are sitting
I mean,
here.
Foot
Okay.
in the ground. Or
I'm saying you are say so. I will place my hand like this. Okay, ask you to close it. Right. So this is flexion of the knee. Okay. No problem. Even if it, because when you move, it is automatically moves. So it will, if it is like this on the floor, no problem. Then straighten it towards. Right. So this is extension. Okay. So flexion, and the patient, if the patient is already lying on the couch, so just place first of all like this. So already being supported. Ask the patient to straighten. Okay, so you place your hand like this and the patient will straighten. So this is extension. Then move your hand downward and ask the patient to flex it. Okay, so this is extension. After doing this, then you will check for the movements of the hip joint. Okay, so hip joint movement, what are those? First of all, place your hands like this and ask the patient to raise. So this is the flexion of the hip joint. In the, when you are straightening, it was extension of the knee, but here when you are asking the patient to raise, it is the flexion of the hip. So check for the flexion. Now this is important that the patient should keep on having a straight leg. If the patient will flex, so it may not be appreciated properly. So the legs should be completely straight. Okay, so straight, and then ask the patient to lift. So this is flexion of the hip joint. Then place your, now this is, place your hand under the calf. Okay, so sorry, below the thigh, yeah, quadricep muscle. Okay, and ask the patient to put it back. Okay, so this is the extension of the hip joint. Okay, so first you check for the flexion, place the hand downward to check for the extension. Okay, then place your hand on the outside of the thigh and ask the patient to spread apart. Okay, so like this. So this is the abduction of the hip joint. Okay, then place the hands inwards like this and ask the patient to approximate. Okay, so he will close. This is called adduction. There are other movements of the hip joint which may be difficult to assess, like circumduction or rotation. Okay, but these are the four which you must check in terms of the power, and obviously the time constraint will be, if the examiner asks you that how you check for that, so this is, you just flex and then you rotate the hip in outward and inward to check for the external and the internal rotation of the circumduction. Okay. Right, so this is the power. The grade is 0 mean no power, and 5 is the normal power, full against resistance. Okay, so 1 is a flicker of contraction, 2 is that the patient is moving against gravity but not against resistance. Okay, not against resistance and not against gravity, so with gravity. 3 is against gravity, 4 is against resistance but less than normal. Okay, and 5 is the normal power. Okay, so Bulk and nutrition, tone, power, and then comes the
Reflexive.
reflexive. No?
No.
Coming in neurology without hammer. Hmm? Check if there is.
By your hand. Your hand.
You can do with your hand when inshallah you
We know the
No.
technique.
We know the technique.
Yes.
but still you have to have the hammer. Okay? None of the other group as well? Huh? Yes, anyone? So, okay, so in the lower limbs, the reflexes basically there are superficial reflexes and deep reflexes. Okay, so superficial reflexes, how many are superficial reflexes? There are 5 superficial reflexes and 5 deep reflexes. Okay, so what are those? If we start from the above, superficial reflexes include corneal reflex, conjunctival reflex, George,